treatable disorder and it should not be neglected, and the treatment is not so difficult, it's not rocket science. And anybody can take it up, especially for vascular surgeons, it's very, very important. Following me, then we talk with my colleague and wife. She does the actual treatment and she will say how you can set up a lymphedema clinic at your home. We are 40 million in India affected by the disease, and around the world is 100 to 300 million. It's a chronic problem, but not recognized as that. That's the first thing. It is a chronic problem. That you have to remember. Filariasis which is one of the known causes, one of the 6 neglected tropical diseases. Whenever the patient suffers from lymphedema, he is disabled, but his disability is recognized as only 20%. And it also occurs after cancer and many other reasons. Post-cancer person, your cancer is okay, so don't worry. You're okay, but the quality of life is really suffering. And this leads to a lot of depression, and to some extent, because they say they cannot be treated, they lead to self-neglect. Forget about it, even doctors stop treating them because they say there's no point treating it because they're not getting better. But we have to try. Basically, lymphedema is an edema out of blood, which, like flooding is caused by damp or excessive rain. Similarly, edema is caused by venous back pressure, kidney disease and all that. Inflammation also causes edema. And in filariasis, is lymph vessel dilatation which is causing it initially. But when you get actual blockage, this is called lymphedema, which can be primary when there are no vessels or less vessels, following node removal, which occurs after cancer surgery, and if there's fibrosis, which is generally secondary to infection. If you look at the lymphatic system anatomy, we have pre-lymphatic channels. I don't want to spend too much time, except that lymphatic heart exists all over the body. They collect all the fluid, thin it down, and retain the dead cells, proteins, the thicker amino retained inside and carried out by peristaltic movement. This goes through the lymph vessels and collectors, and then at the lymph node level, it is broken down to smaller segments to allow the fluid to be reabsorbed, and up the line it goes and just joins the thoracic duct in the neck. And only 1 to 2% of actual fluid which has started from the bottom goes to the neck. In between, the cleaning takes place. And if the cleaning is affected, you get lymphedema. Basically, so I told you about lymph production. The body has got 10 times the capacity to carry the normal lymphatic fluid. When you exceed that, you get persistent edema. And once that decreases, you can never get that back to normal. It will be 4 times, 5 times, but never back to 10 times. That's why lymphedema is a chronic problem. And you can improve it by conservative methods, which we'll be telling you about. Surgical is also possible, which is coming up, but it is only a one-time process, and only you get the increase in 10 to 20%. You cannot increase it fully. So even if you are going to do surgery for them, which many plastic surgeons are doing, you have to have the backup whether the surgery fails or you're not able to increase them enough. You have to do the conservative therapy. And the various types of lymphedema, I don't want to spend time of it, all of you know it, post-inflammatory, post-surgical, post-traumatic, and there's a mixed type in which you get lymphatic or venous type, even vein disease. When the secondary infection occurs, you get what is called pleural lymphedema, but basically treatment of all these lymphedemas is generally common. You have to treat the cause, which I'll be explaining to you about. Even in filariasis, there's an initial lymphedema which is because of the dilatation, because of paralysis of the vessels, but later when secondary infection takes place, you get what is called persistent lymphedema. So this is what I want to explain, that any cause which causes an imbalance of demand and flow of the lymphatic, we have a stagnant body fluid, which is a very good culture medium, and following that, you get secondary infection, which is generally community-borne streptococcus or staph. Gram-positive infection, and penicillin always works. And then it leads to fibrosis, further blocks, so this is a vicious cycle which continues. If you treat it, just break the cycle at the appropriate pace as you can. But most of it has to be done through what is called compression therapy, which will tell you in detail about. Another important component is good skin care, prevention of infection, which I'll tell a little bit about, and penicillin. Another common disease of now is what is called lipedema, which occurs in the females largely because of hormonal change. And that hormonal change, you get a symmetrical lymphedema, but again, over a period of time, because your lymphatic vessels are separated by the fat from the muscles, you can get what is called lipolymphedema. So that also treatment is largely the same. The only difference between lipedema and lymphedema is that lipedema is generally painful. Lymphedema is not painful unless there's secondary infection. All of these, so this is the flood, like on the road, if after a flood you get potholes. Similarly, the body gets potholes inside called lymph lakes. These are the places where the nidus of infection is lurking around and can flare up anytime. You have to take care of them through compression therapy. So the treatment is first and foremost prevent and treat infections. You have to prevent the acute inflammation, which is called ADLA or adenodermatomyositis lymphatic attacks, good skin care. Many of these patients will have a fungus, so you have to put your fingers between the webs, clean them nicely. You have to look for a fungus. You will find them in 70% of the leg cases. Clean the fungus because they are the entry points for the bacteria to occur. Wash with soap and water, wash off the soap, then wipe dry and put an antifungal powder or a liquid. And then of course you have to, the very important thing, then general infection you have to treat and treat ulcers and all that, which are again places where bacteria are going into the body. Penicillin is the best antibiotic. Why? Because it is cheap, narrow spectrum, specific for ADLA, it is safe. There has been no incidence of anaphylactic shock after the starting of disposable syringes. It was not penicillin which was causing the anaphylactic. You do get delayed energy, which you can do after a one-time sensitivity test. You don't need it repeatedly. And we have been giving this around, we have given 20,000 shots in my clinic. Not a single mortality, no problems. And I don't want to spend time on that because it's short of time. There is a role of surgery or like any surgery, you have to do surgery for certain things. You identify what is the goal. Do you want to increase the flow? Only possible in early cases to increase the 10 to 20% of lymphatic, because if you have got 8 to 10 times the lymphatic capacity, increase it to 10 times to have this thing. Later stages it will not work because you are not treating the other main cause which is causing it. Of course, the other important surgery is what is called debulking surgery, which is to allow a proper bandage fitting and compression to take place. That's the idea behind it, also for cosmetic purposes. Again, I don't have time for this. So the management summary plan is infection, always treat, always prevent through penicillin, fungus and carious teeth also. Adverse lymph flow, test by lymphography. Functionalist by using what is called CDT. We will tell you a little bit of what is CDT, then compression decongestive therapy. Then you need lifelong compression therapy, skin care and psychosurgical lymphodynamics. Some of our results which I want to show you, I don't know because my time is up. These are some of the results. We got excellent results. And this is a patient who has been treated with very, very large limbs and we get very satisfactory results. But you have to stay at it because if you leave the treatment, it will come back. That is what you have to counsel the patients. Don't stop the treatment ever and they have to continue at home. We have to train them how to continue the treatment at home and explain them about the various things about the disease. This is a patient who was bedridden and now he's running and dancing and all that. So it is treatable. Quality of life improves even in advanced cases. Treatment simple but requires a change of mindset. Therapists have a major role and my wife will tell you about that. Antibiotics, massage and self-care are important. We have treated these patients remotely also by telling them telementoring now, and telemedicine has a huge role which we are following up. And this little photograph that you're seeing out here is showing that a patient who had come to me from another place, the fungus had not been seen and you can see that I could see even on a photograph that the fungus was there in the lip. That was the step from the infection was taking place. So these are some of the cases, 10-year follow-up, another patient. Thank you.